So, Gabby, you are a physical therapist, a athletic trainer, and a yoga instructor.
Yes.
Okay, so we're going to go through all of these, but let's tackle one at a time.
Okay, awesome.
Physical therapy. I guess explain your background, how you got into it.
Yeah. So, kind of, I feel like 90% of physical therapist story was, I got injured, and then that led me to the field. So I kind of fall in that bucket. In high school, I had 2 injuries that basically caused me to be in PT for a year plus, so 2 years total. And within that course, going to school, I was like, okay, I'm in college. Let me figure it out. Let me find my path to physical therapy because that was something I wanted to do. I feel like I'm a very empathetic person. So caring for people is it seemed so easy for me to just fall into that field. So going to UCF, wound up getting into a health professions class, found athletic training first. So I was an athletic trainer, got my undergraduate in athletic training. And then after that, found physical therapy. But my injuries led me into the experience of going through physical therapy and the difficulties and hardships that it came along with. And then seeing the result of that hard work or of the one person who's influencing you and pushing you to be better.
Yeah.
And seeing how influential and almost, I don't want to say it was like, they're pretty tough to be a physical therapist. You have to push people and you have to be patient and understanding, but also, you got to have your wits about you a little bit too. So I felt like that kind of fit my personality too a little bit.
Yeah. I mean, it's kind of hard to tell people that they need to do something they don't want to do because of pain,
Yeah.
So,
yeah.
But knowing it's for their own good. Mm-hmm.
Yeah. I feel like a lot of my job is just like educating people anyways.
Yeah.
A lot of people I come into contact with in my normal daily life are very aware of their body, but that's just like who I surround myself with. But dealing with a normal population of humans, they're not so aware. So
okay, so there is a difference between athlete patients and then non-athlete patients.
Oh yeah.
Who's easier to deal with, or who's harder, I guess?
Who's harder? Honestly, I think someone who's more aware of their body is harder to deal with because then every single thing you do is, an opinion or a criticism or this doesn't feel right. This it's a little bit more. I've worked with athletes. I've worked with older adults. I've worked with older athletes. So I've kind of the whole spectrum. But I feel like someone who is more aware is easier in an aspect, but I think psychologically a little bit more difficult.
I can see how it can be more psychologically traumatizing for them because this is something they love to do. And now they're injured and they can't do it.
Exactly.
So I can empathize with that 100%.
Yeah. Have you had injuries?
I have. So when I did MMA and jiu-jitsu at Jungle.
Oh, yeah.
I'm pretty sure.
You can't not get an injury doing that.
Yeah, I get injured all the time. I got eye poked. I'm pretty sure I tore something in my rotator. And I think I have LCL issues or IT band or something.
Oh, yeah,
something
you asked
here
me about
snaps.
that the other day. Sorry.
Something here snaps when it gets pressed a certain way. But knowing that if I went to the doctor, they were going to say, you have to take it easy and stop for a little bit. I didn't want to stop. So I just trained through the pain.
I think a misconception is, this whole concept of RICE, like rest, ice, compression, elevation, right? When you get an injury. But I think there's so much power in movement and so many injuries can be prevented by movement and can be healed by movement. So resting completely, no. Modification, yes.
Yeah. I mean, they would probably tell me, like if you tore a rotator cuff, and let's say you don't need surgery, you probably don't just want to do nothing. I'm sure there's like some like band exercises you can do to strengthen it. But what they're going to tell me to stop is the thing that I love doing, which is either jiu-jitsu or in your athlete's case, whatever sport.
Yeah. So, yeah. I've got a jiu-jitsu, BJJ, like all the BJJs. Jiu-jitsu.
Do you have clients that come in?
But yeah, I've got judo, karate, like a ton, all of it, wrestling, everything. But you got to be on your arm. You got to be doing this stuff. And to completely tell someone that they can't do the things they love is gutting. Like what else? It is. They think like, what else do I have to live for sort of thing. So not really, but I mean, can be an extent.
If it's their livelihood, probably.
Yeah, of course. If it's like their passion and they're, get off of work and I'm so excited to go do X, Y, Z.
Yeah.
This is where I have family. This is where I have friends. This is where I have a community.
Similar. like someone telling you can't do yoga or something.
Yeah.
You know?
Oh, yeah.
Like that's going to be a blow.
Gutting. Yeah.
So what are some of the common injuries and conditions you see in your practice usually?
Yeah, I mean, so we kind of just went over a ton of it. Ton of shoulder. Shoulder, not so recently, shoulder replacements, but obviously I've seen that in the past. A lot of like torn rotator cuffs or labral injuries. More recently, we had like clavicle fractures. That the start of football season always brings fun new stuff. A ton of knees. That's probably my number one
Ton of knees.
injury is knee stuff. So whether it's patellofemoral syndrome or like that anterior knee syndrome, ACLs out the wazoo, so many ACLs. Yeah.
So why do you think the ACL is such a common injury? Like what is it about that specific, is it a tendon or a ligament?
It's a ligament.
It's a ligament.
Yeah.
So what is it about that ligament that makes it easy to tear? Is it just very load bearing, like when you bend your knee?
That's a good question. So the normal mechanics of sport in general is like you are cutting, you're running, you're twisting, you're landing. The ACL is a ligament that prevents basically the femur to go over the shin. So it prevents this sort of movement.
Oh,
so,
I see.
for when you're landing, if you have poor muscular coordination or even not only that, so there's kind of two versions of an ACL injury. It can be contact or non-contact. So most of them I feel like are pretty much non-contact because, women are a little bit more prone to ACL tears than men just because of our structure. So you have more of a higher risk for injury if you have what we call like a valgus force at the knee or a valgus alignment of the knee, which is more medial forces. So it kind of goes in like this. So that's like a risk factor. Like a landing twisting motion is big ACL, big meniscus, mechanism of injury as well. So just like our normal activities, that's just the ligament that unfortunately kind of gets all that force. If you, again, are female and you have more lax joints, like more ligamentous laxity, that's something that obviously predisposes you as well. So I had both my ACLs. I mean, I tore both my ACLs.
Oh, you tore both?
Yeah. So I was like, whatever. I've been through this a few times. But I just had a kid who, his was contact. He tore his ACL, MCL, PCL. Had a patellar dislocation and an MPF fell tear. So that's the ligament that keeps your kneecap pretty much in place. So his whole knee just boom. But
wow.
Yeah, he's been very...
he's
been a trooper. Such a tough injury, but he's been doing great.
And this was a football player?
Yeah, high school football player. He got landed on. He went and it got just piled on his
and
foot.
Just everything just tore up.
Oh yeah.
Wow.
I know. I couldn't imagine going through that.
So from what I've seen, joint areas get injured quite a bit, and it's probably worse to get injured in joint areas than to have like, I don't know, it's not a compound fracture, but a complete break, like in the middle of a bone. That's like an easier thing to recover from than a joint, right?
So, I would say yeah.
Okay.
I would say something like a fracture would be easier to recover from, depending on like where it is, obviously. So, for instance, again, we just had this recently. We had a kid who had a tib-fib fracture, so he kind of broke both bones. But with that being said, kind of whenever you immobilize something for so long, the muscles around it are going to atrophy. The thing with joints that are the most difficult, I think, in my opinion, especially knees and shoulders is, and hips especially, is the range of motion loss that you kind of have to work through.
Yeah. And scar tissuing maybe, so
everything.
things don't like bend as well
Swelling,
anymore.
scar tissue, atrophy, all that stuff.
Yeah.
Yeah.
Okay. So let's say, what can people do to like prevent as best they can these types of injuries? What are some like pre-workout stuff or,
I think mobility is a huge thing. So everyone's body structure is so different, right? So I'm probably a little bit more like lanky and flexible, not so strong. you have kind of like a mid sort of like mesomorph body type, I would say. So kind
I'm
of
a little more exomorph, I think. Yeah, I'm definitely.
Are you? I don't know. I feel like you have like a good muscle definition. So everyone's going to have their strengths and their weaknesses. So I think being able to identify those things and kind of working through whatever deficits you have. So for me, like I strive in flexibility, but strength is very tough for me. And I know I have unstable joints. So for me to prevent injury, which I feel like I'm always injured, but for me to prevent injury, I really need to focus on strength. For people who are a little bit more solid, they're going to want to do more mobility training in terms of strength through flexibility, right? So, like a lot of the CrossFit people, a lot of the CrossFit community, they do have great range of motion and strength through those ranges, which I love seeing and I'm amazed by every day. When I walk into Subo, I'm like, how are these people doing this? But I would say like becoming aware of your body and really paying attention to what your body is telling you can prepare you so well for preventing injury, because if something's feeling off, not ignoring those signs, but actually paying attention and listening and doing something about it, whether it's getting in the gym, doing yoga, going to get a massage, like all these sorts of things are preventative.
Yeah, I think in my case, it's definitely the flexibility.
Yeah.
Because I'm not very limber at all. And I'm pretty sure I can prevent a lot of my injuries. I don't have too many injuries, but being more flexible, I think I can definitely do it. This would be interesting to figure out. I'm pretty sure there's something. I'm wondering what is the most injury-prone sport and where CrossFit falls into that. If I had to guess, I feel like people get injured less in CrossFit than they would in like football or baseball.
I mean, so different, you know?
They are different sports, definitely. I'm not saying there's no injuries, but I feel like CrossFit just, like you said, it trains your body to be strong in almost every aspect it could be.
Yeah.
You know? So as long as you're doing things safe and right and not pushing things, you're kind of okay.
Yeah. The thing that I do find, so I've had, before I started CrossFit, I had a ton of CrossFit patients, and they would always come in with these like chronic injuries that they would just push through. But that's the thing. That's why I think it's important to listen to your body, because if you're constantly doing, you're trying to do toe to bar, but you have a hip flexor strain, you're not going to make it any better by continuing to do toe to bar. But I would say the difference between like CrossFit and other sports and the maybe not difficulty level, but like injury level is that component of contact. Okay. Because you can have someone run into you at any point in time. Although you can have a barbell fall on your face, like you can also definitely other people, and those cutting, twisting, pivoting motions are a big deal. And that's, I mean, soccer, huge proponent for knee ankle injuries, volleyball landing, football, everything under the sun, fractures, concussions, the whole nine. But every sport has their thing, you know? Of
course. Do you get what's your demographic as far as sport? Like what is the most injury prone that you think?
So we've kind of had a little bit of everything. Right now, our number one is soccer, football, lacrosse. Well, we're not in lacrosse season, but when we're in lacrosse season, lacrosse. Mostly female lacrosse players. And then but I've had everything from a lot of runners, right? Sort of like chronic running stuff. We get a lot of basketball players, knees, ankles. We get a lot of baseball players. It's so variable depending on the season. It's everyone. But a lot of baseball is going to be shoulder, you know. A lot of soccer, basketball is going to be knee and ankle. A lot of volleyball is going to be knee and ankle. A lot of football is going to be it could be anything. Football can be anything.
Yeah, it seems like the shoulder and the knee and the ankle are the three. Ankle.
Yeah, I've seen a lot of hips recently in the non-athletic population, like more hip replacement, bursitis, stuff like that in my older adults. I love the hip.
Yeah.
Hips are my favorite.
Hips are your favorite?
Hips are my favorite. Knees used to be my favorite, but hips are my favorite.
Is it a more complex joint?
Yes.
Because it does bend like almost 360, right? Compared to the knee. It's
front, back, side, in, out.
Oh, interesting.
Yeah.
Super cool.
It's more complex.
Okay.
And I've been dealing with my like hip impingement for the past few months.
That's right.
I guess I got to figure myself out.
That's why you're into it, because you got the injury right now. So you're probably doing all the research.
Exactly. Yeah.
That's awesome. Okay. Well, it's not awesome that you're injured. It's awesome that you're that you're into it as deeply as you are.
I think experiences mold us, right?
So, okay, if someone wanted to find a good or the right physical therapist, maybe not good, the right physical therapist, how does one go about finding that?
So, I'm actually, when I saw that question on there, I was very interested because I feel like a lot of people don't have maybe the best reputation in their head of physical therapy when they've been through it in the past. And I have a few friends who have been through physical therapy and they're like, that wasn't what I was expecting. I didn't get any results, or they were just throwing ice or heat and like electrical stimulation on me. And then I just didn't do anything. My biggest thing is physical therapy should be physical. You should be doing things. You should be exercising. You should be learning like new techniques or modifications for your normal activity levels. You should be getting back to the things you want to do. And this is mainly, I'm just speaking in terms of orthopedic physical therapy or orthopedic or sports physical therapy. But I think if people are looking for a good physical therapist in terms of ortho and sports, outpatient, you need to go to the facility to see what it's like, read reviews and all that stuff. But go to the facility, see what it's like. A lot of times they'll do like quite a few patients an hour. Some physical therapy clinics are like PT mills, so they get people in and out, and it's just boom, 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 boom. More focus on the productivity than the patient care. For me, I would like to talk to, we do an evaluation first too, but talk to your PT, see if they're meeting your expectations as well. Because even if I come into you after an ACL tear and I walk in and it's like all old people, will I feel comfortable doing that? No, probably not. If I see a bunch of kids like hopping, jumping, skipping around, will I feel more comfortable? Yeah, probably. So I think setting goals, making sure that, they can be appropriately achieved. Social media has a huge play in stuff nowadays where I feel like companies are promoting themselves more, but for those like older companies, no issue with them being older companies and maybe not acquainted to social media. But I think like going in, talking your PT, having that personal interaction, because physical therapy is such an in-person sort of thing. That's the reason people come to us.
Yeah.
Right.
I think that's a general problem with the healthcare system is it does seem like
routine.
It's just like in and out, in and out, in and out, and they just, you'll tell them your symptoms and then they'll just throw something at, try this. Yeah. Try this. It's like, do you want to ask more questions? Do you want to do some tests? Like, the general healthcare system seems that way. I'm sure when you say outpatient, you're talking about things like outside of the hospital.
Correct. Yeah.
Okay. So that they can focus more on that. Whereas the hospital, they're probably crammed with so much stuff. They just want you in and out.
Yeah. More inpatient stuff would be like post-operative surgery. Like say I have a hip replacement, knee replacement. I'm an inpatient PT for like a day or so. And then, or like if I'm an older adult, that's acute PT usually. But inpatients like, maybe someone who had extensive surgery and they're in there for like 2 weeks or so. That's kind of more inpatient. But for outpatient, this is like your normal whoever coming to us. And the nice thing that we have in PT now is direct access. So we don't need someone to go see a doctor first. They can come to us in Florida for the first 30 days without a script from a physician.
Oh, nice.
And PTs are musculoskeletal experts, I would say. So for us to do an evaluation on someone musculoskeletal, we spend an hour. We figure it out. It's like a puzzle. That's why I love PT. Everyone's like a little puzzle piece. So figuring that out and trying to put pieces together, I will always stand by being an advocate for my patient. And if they're describing all these symptoms that don't make sense, I'm not going to throw a medication and send them to the back burner, which I think people are getting much, much better at that. But, for like a primary care physician, musculoskeletal may not be up their wheelhouse. So having a whole collaborative team to chat with and discuss patient care with is so important. And I do think having a great relationship with local physicians is the best thing you can do, because the support all the way around patient care is what gets a person better. Psychologically, physically, mentally, all that stuff.
Got it. Yeah, so you guys work closely with the doctors, and any scans they have, then they send it to you after that. Okay. All right, so what are some of the challenges and rewards of being a physical therapist?
I think the challenges are definitely a little bit more of the like psychological aspect of it. So my brain's never turned off for work stuff. Kind of.
Yeah.
So like I'll leave and then I'm like thinking about my patients and how I could have done something better or how they're feeling or XYZ. And because I had said earlier, I'm a little bit of an empath. So when somebody comes in and I feel their energy, I'm very observant of any sort of slight changes in how they present one day to the next, and just constantly wanting to be at my best so they're at their best. But I think that can be, like, as a human, that can be a little tough to deal with sometimes, you know? Especially like being around people in pain and not being able to get them to understand the importance of like having just knowing what the meaning of pain is. Pain isn't always bad. Yeah. But just having them understand more. It's just emotionally draining sometimes.
This actually leads into the next question. So I can see how it can be emotionally draining for you. And it can also be like emotionally draining for the patient as well, right?
Oh, definitely.
So this kind of leads into the next question was, can you share any insight into the emotional and psychological aspect of going through PT?
Yeah. I think PT is a scary... So if you're dealing with like a pretty severe injury, like my high school kid, or if you've been dealing with chronic pain for years, there's many things in life that have deterred you from doing your normal activities, whether it's pain, whether it's like lack of function to be able to do these things. So someone's livelihood is affected by these conditions. And when they come into the clinic, they're wanting to get help. And so I feel as it's my obligation that I need to get this person back to doing whatever they need to be doing. But with that, for the psychological aspect of the individual, I'm a very lighthearted person when I talk to my patients. I don't sink on them pretty heavy, but I need to be honest and blunt and upfront with them in regards to what I think their actual course of care is going to look like. Like, I'm not going to sugarcoat things and be like, you're going to be fine in 2 seconds, right? It's going to be a tough process, but we're going to get through it together. And please cry when you need to. We've got tissues. If you need to scream, do it quietly. If you need a stress ball, we've got some, but it sometimes can be a grueling process. But I think for me, as someone that they're looking to for guidance, to provide a uplifting, encouraging, and kind of strict a little bit environment, right? I don't let people come in and just, oh, I can't do this today. Like, we're doing it. If you're not feeling great, we'll modify it and do something else. But we're not going to just sit here and just hang out. Like, this isn't a space. We can socialize, great. My biggest thing is I'll try to distract people and like get to know them and, know their quirks and their antics and try to, distract them from the discomfort that they may be enduring for the short time, to try to get them to see that there's a bigger picture to why they're here and what they're looking towards. Yeah.
I've seen like videos maybe on social media of like very motivational like PT recoveries, where you see, someone actually motivated to get better and to do better, and they're pushing as hard as they can. Is that not as common as people who are probably discouraged by their injury? And like, is it a mixed bag of that, or?
Yeah. I am very fortunate to deal with a patient population who pretty much everyone in there wants to get better. Hashtag get better. That's our like motto at my job. Hashtag get better. But no, I'm very fortunate to be dealing with a population who wants to change, who wants to feel improvement, who wants to return to their normal daily activities. I think, again, it's finding what motivates people, because if I am trying to just get back to walking, like, okay, whatever. But if I'm trying to get back to playing with my grandchild, right? So a lot of older adults, they're like, oh, well, I don't really know if this is going to work. Well, what sorts of things do you love doing? Do you love gardening? Do you want to play with your grandkid? Do you want to lift them up from the floor? Do you want to walk around, go grocery shopping? Do you want to go play bridge? Like, what sorts of tasks do you love doing that feels like your livelihood? Don't make it about exercise and you need to exercise. Think about, I need to go walk down the sidewalk to go get my mail so I can receive a birthday card from my family. So it's like setting aside those small, attainable, realistic goals that they're motivated to get towards is what I think gives them that motivational story. Because not everyone I encounter is going to want to get back to Division I collegiate athletics.
Yeah.
You know? So I think like setting everyone's motivation is so different.
Got it. Yeah. But encouraging them and telling them like, you know, the reality of this is going to be hard, but eventually we'll get through this. You'll get better and you can get back to a normal life.
Yeah.
But you got to go through these moments of pain and struggle to get there.
Definitely. Yeah.
Awesome. Do you recommend any resources or organizations for the listeners if, you know?
Yeah. I think there are, and the beautiful thing again about social media now is there's so many resources for, you know, injury prevention, for injury treatment and all these things. My biggest thing for reaching out to these professionals is I would try to say to find someone local in person if you're going to do the physical therapy route. I would highly suggest my company, but that's biased, so I won't say anything. But as far as resources, I always tell my patients, go on YouTube, look at some stuff, try it out. Like if you're scared to go to physical therapy because of insurance or, you know, financial or time constraints, there are so many resources online that are helpful. I don't super want to name drop any, but we can maybe throw some in there at the end. But online is such a great medium. Social media is a great medium. Don't believe everything you do see on social media, though, because some of these, not PT pages, but like more of these like strength and conditioning sports performance pages that you see out there, they just do like ridiculous stuff. And honestly, it's quite funny. But everyone's got a kind of different style. So I would say like the biopsychosocial approach in terms of using research, using patient care, using things that they know just work with different patient populations is important.
Got it. So
there's a lot.
Your company that you work for, they have their own social media page.
We do.
Like if you go to an official PT facility's social media page, you can almost trust everything they're saying there is beneficial and not.
Say.
Okay.
Yeah, I'd say for the most part.
Yeah.
Yeah. I mean, at least like my company, we do a good job. We don't put like so much factual, like, hey, do this specific thing for this. And not to be whatever, but if you're a physical therapist and you're giving out free care to people, your time, your education is so knowledgeable. Like you can put videos on like 3 stretches for groin pain. Like, sure, that's fine. But for someone who has an injury and is looking for something for them, everyone's body is so different and everyone has so many different like body types, goals, or, you know, restrictions. So to find a one-on-one evaluation or something that someone's molding the care for you is what is going to be the most beneficial thing for your body.
Yeah.
You can try XYZ under the sun, but if you're not getting better, that's when you need to take that extra step and find someone to talk to.
Yeah, that makes sense.
Yeah.
That you would want to still come in to cater something to your specific body type and your specific injury and your specific needs.
Yeah, exactly.
That makes a lot of sense. Okay, so let's shift focus to athletic training. What are the key responsibilities and roles of an athletic trainer? And how does it differ from other healthcare professionals and sports medicine?
Yeah. So athletic training, we've kind of got a few domains that are in our Practice Act. So we are emergent responders in terms of like on-field emergent care. So whether it's wound care, you know, responding to a head injury and needing to spine board someone or splinting a fracture, all that stuff. So we have that kind of under our belt, CPR, all that. We've got injury prevention and rehabilitation. So a little bit more of that, like inside the training room, you know, doing different exercises for the prevention aspect kind of coincides with strength and conditioning coaches as well, I'd say. Okay. So prevention of, you know, coordinating with them and making sure we have things implicated in the athletes' strength programs or like out of season care where they're able to do things that are specific to their sport to help their bodies be stronger and more resilient for their sport.
Got it.
So that, I would say like coinciding with other with the other side of the team, with the care team would be helpful for that. So injury prevention, diagnosis. So we do diagnose stuff.
Okay.
I wouldn't say at like a clinical level in terms of like sending this diagnosis to the doctor, because an athletic trainer usually is supposed to work under the supervision or the guidance, we'll say, like legally, of a physician. So communicating like, hey, this looks like this, not like, hey, this is this, to a doctor, you know, I think that's, but special testing, manual muscle testing, all that stuff. Again, musculoskeletal is our wheelhouse. The thing that differs athletic training, I think, from like physical therapy, for example, athletic training, the education now is a master's, before I got it as a bachelor's degree, but it's a deep focus in orthopedic and sports medicine. So more of the sport injuries and conditions, whereas PT is full systemic and tegumentary. So like skin stuff, neurological, pediatric, geriatric, orthopedic as well. But there's so many other realms within PT education that you learn, where athletic training is kind of just honing in on those more athletic injuries and stuff like that. Sports or that makes sense. Orthopedic, management, so like professional management, documentation, designing a athletic training room. All these things are things that we've learned, and obviously curriculum has changed since it became a master's. But let's see, injury prevention, diagnosis, rehabilitation, emergent care. What am I forgetting?
Treatment, organization, administration.
Admin.
Professional responsibility.
So I would say like professional responsibility would be like advocating for the profession, I think.
Okay.
But so athletic training has like a stigma. Like, oh, you're a trainer? Cool. Like, can you help me lose weight? And I'm like, oh, no, I won't. But, you know, a lot of the education is the strength and conditioning stuff. So one of the big books that we use.
Had a short break. We went through the responsibilities and roles of an athletic trainer.
I was saying that I can't help people lose weight. So the term athletic training, I think, doesn't really encompass maybe the level of professionalism and education that we go through. So athletic trainer, maybe physiotherapist, but that's also in the realm of physical therapy. But I don't know how that could be maybe branded as a new term, because we don't just work with athletic people. Athletic trainers are in clinics, they're in industrial settings, they're working with performance. So there's like athletic trainers for Disney, you know? So I think it's
as long as
the profession needs to evolve, I think, a little bit.
So I mean, an athletic trainer is anyone who just deals with an athlete on any level for prevention, strength, and care.
Like medical care.
Right after injury, right? Or right if injury happens.
Before, during, after.
During, after? Okay.
See, this is the tough part. It's like, where is that that difference? So you've got physical therapy aides, right? Or sorry, physical therapy assistants. So they go to school for that.
Okay.
You have athletic trainers, which is like its own little subdivision. And a lot of it is working either in secondary schools or in high schools, or professional or collegiate, or in the clinic. But in the clinic, so the thing about athletic training is, in terms of insurance and billing and all that stuff, like they don't have the ability to do those things. So the reimbursement and the salary overall is less than like other healthcare professions. So it's a little tricky. Honestly, I think there's not enough respect for what athletic trainers do in the grand scheme of other healthcare professions. Because like, we're just doing everything under the sun. An athletic trainer is truly a jack of all trades. In my opinion. And I wish there was more recognition and appreciation for the profession.
Is schooling different? Like, are they two separate majors, or can they both kind of fall under the same?
You're talking about like athletic training, physical therapy?
Athletic training and physical therapy.
Different. So physical therapy is a doctorate level degree.
Okay.
And you have 4 years of undergrad, and then you can go straight into your doctorate. It's a clinical doctorate. And then athletic training now is 4 years undergrad, and then it's a 2-year master program.
Okay.
2 or 3, depending on the program.
All right. So you still have to be very educated to do
No, yeah, you got to be educated. I mean, it's a health profession, so you definitely got to be educated about it. It's just different. I do love athletic training, and I'm such an advocate for it. I think there's a lot of things that I just wish people knew more about it. I really wish people knew more about it and could appreciate all the hard work and time and energy that goes into being an athletic trainer, because they're a dime a dozen nowadays. So
yeah, well, I'm sure the athletes appreciate it.
Definitely. Yeah.
Because they definitely need you.
Yeah, definitely.
This might have been already answered already, but what is the importance of injury prevention in athletic training, and what strategies or programs do you recommend athletes to minimize the risk of injury?
Yeah. So there's so many different steps that can be taken as an athletic trainer implementing this into the athlete's care. So if they have a history of an injury, any sort of like prophylactic bracing or taping or anything like that can be helpful, but also just maintenance of general conditions. So for example, for a baseball player, for a pitcher, maintaining like an arm care program will be helpful just for future prevention of any sort of shoulder, elbow, wrist injury, right? So all those sorts of things. Every sort of athlete has a different task that they need to perform. So making things very sport specific, whether it's plyometric training or, just strength training, like brute strength for, throwers or lifters or anything like that. So periodization is very important too, and knowing how to appropriately instill different techniques of exercise throughout different time frames of the season, right? You're not going to do crazy strength training right before your season starts, right? So, or like in season. So it's all about like understanding periodization for training.
Got it. Okay. So this is something an athletic trainer can do, is give you specific strengthening programs for the exact position or thing that you're using it for.
Yeah.
Like you said with the pitcher. So,
yeah. I would say that, and this is kind of where the crossover is a little difficult. I would say that I think like athletic trainers are very capable of doing so. However, usually it's in conjunction with a strength and conditioning coach, which that is their wheel. That's what they're doing, right? That's what they're doing. We are more so looking at the medical side of it. So we're looking at the injury, prevention of the injury in terms of, okay, what can we be doing? But we're not going to really instill that and be by their side because, to be honest, we're dealing with 20 other athletes and all their care. Plus, setting up the field, breaking it down, making sure everyone's hydrated, making sure that, there's no lightning going on in the air. Like there's just so many things that an athletic trainer has to wear on their hat.
You're responsible for everyone's health and well-being.
Yeah. No, yeah, literally.
Times.
Yeah. Like at a high school, you're not just working with like one athlete, one team. It's literally every kid on that campus that's doing a sport.
Yeah.
Like it's just so much.
No pressure.
No pressure. No, it's fine. Yeah.
Okay. So, how do you assess an athlete's physical condition and develop customized training and rehabilitation programs or plans? I'm sorry.
Like how do you do the eval pretty much?
Yeah.
Yeah. So first step is observation. So like in terms of doing an evaluation on somebody who comes into you, a lot of it is, observation. You're going to put your hands on the patient, see how they're feeling. Use your anatomical knowledge to palpate around their joints or muscles or whatever. And then it's a knowledge of knowing the kind of signs and symptoms of different presentations of injuries. So if somebody comes to me with ankle sprain, I kind of already can, by asking them questions about how did you injure this, kind of already know what's going on. So a lot of it's talking to your patient. Then when you get your hands on them, doing any sort of special tests, meaning stressing the joint, stressing the tissue, seeing how they respond to it. Muscle responds different than ligaments. Ligaments respond different than tendons, all that. So,
brief tangent. What's the difference between a ligament and a tendon?
Yeah, so ligaments connect bone to bone. Tendons connect muscle to bone. Tendon is just the extension of
the
muscle.
muscle.
Yeah.
Okay.
Yeah, good question.
But that's such a clear definition.
Yeah, sprains are for ligaments, strains are for muscle and tendons.
Is one harder to rehabilitate, whether it be the tendon, muscle, or the ligament?
So, so most of the time, if you tear a tendon completely, you need surgical intervention. If you have a partial tear of a tendon, like Aaron Rodgers, he had an Achilles tendon tear, right? That's probably one of the more difficult tendons to rehabilitate because they need surgery. So a tendon is complete severance of the muscle from the bone, so you need to reattach it. If you just have a muscle strain, way easier in terms of you don't need surgical intervention, but because it has contractile properties, really good blood flow, that'll kind of
I was about to say
heal on its own.
Blood flow is the important thing for healing, right?
Yes.
Okay.
So muscles would be like your body will take care of healing that itself. Tendons, depending on the degree of tear, may need surgical intervention, could be treated conservatively, may take a little bit longer. And then ligaments, if you tear your ligament, you can live with a torn ligament, but most of the time needs reconstruction of sort.
Got it.
Yeah.
Okay.
So I wouldn't say every comes with its like con and pro and con, but in terms of easiest, maybe I would say easiest in my head is like non-operative.
Yeah.
Maybe.
It would be the muscle.
Yeah.
Right? Because that thing can heal itself, like you said.
Yeah. It's more like maybe it's longer maybe in recovery, but surgery's long too. So I don't know.
Yeah. They're all bad, but.
Yeah, they're all not great.
Yeah. So for instance, when I had the rotator, that rotator is a tendon, right?
So the rotator cuff is comprised of 4 muscles.
Okay.
So usually people who have like a rotator cuff tear have a little bit of a tear of one of the, it's usually the supraspinatus tendon, or like a little bit of the muscle belly, mostly the tendon that kind of runs underneath the shoulder.
Got
and
it.
Attaches down.
Okay. But they're all tendons, right?
There's
they all connect
tendinous
to muscles.
insertion. Yeah.
Okay.
4 muscles, 4 different tendons.
So actually, this is
are you mind boggled now?
I'm gonna like test your
anatomy knowledge
right now.
Okay.
Where are most of the ligaments? So you got them in the knees.
Yeah.
You got them in the ankles.
Literally everywhere a bone is, there's going to be a ligament.
Okay, so wherever there's a joint and socket,
wherever there's a joint, there's going to be a
tendon.
ligament and a tendon.
Okay, a ligament and tendon. Okay.
Not every joint has tendons, though. There's not always tendinous insertion at every single joint.
Yeah, that would make sense. So
and joints have multiple tendinous insertions too.
Okay, so you always need a combination of both. You need the ligaments to keep the thing in place.
In order to have a joint, you need a ligament.
Okay. Yeah. Just to keep it in place, right? To keep it from slipping and going somewhere.
Yeah.
Right? It's just like a nice...
And then the muscles are just there to move it.
And the muscles are there to move it.
Yeah.
Which will need the tendons. Yeah. Damn, this is so interesting.
Human body.
If we would have done this when I was trying to figure out what I wanted to do in college, I probably would have done this because it's so interesting. Like anatomy. I also have a fascination with the brain too. Like that's even more...
The brain...
Yeah.
Yeah.
Neuroscience.
Neuroscience. So when I was in PT school, so we did gross anatomy dissections with cadavers. And the first half of the semester was musculoskeletal. It was great. Fine. Then the second half of the semester was more neurological. Oof, so much. There's just so much.
Yeah.
And I have a few friends who are in neurological PT and they love it. And when I was going through school, I loved it too. But there's just so much you got to know.
Because I feel like there's there's still stuff left to discover, right? On the brain side.
The thing about neuro is you can't see it. You can't always see it, you know? So with musculoskeletal, it's there. You can see it. You know how it moves. It's physics. It's biomechanics, right? But with neurological conditions, there's just so much involvement systemically. And some of it sometimes doesn't make sense. But there's always a surprise and always keeping you on your toes and even more of a puzzle. Like orthopedics is like a 50 count puzzle. Neurological PT or neurological patients are like a 10,000 piece puzzle. Yeah, but I love it. I love it all. I love it all. A lot of pediatric physical therapy pediatric, just PT in general is so heavy neurological.
Is this something you can still get into since you're a PT?
Yeah.
Okay.
Yeah.
Nice. Do you have to take like I don't know, certificates or something like that? Or do you have to go back to school and get like neurological
So if
PhD?
you want to, so in PT, you can like specialize in things. So if I wanted to get like my sports certification, I could take an exam for that. If I wanted to get orthopedic specialization, do that. Pediatrics, neurological, they all have different like specializations, but you don't need that to work in that field.
Got it.
Yeah.
Okay. All right. That's super interesting, man. Okay. So, what are some of the common misconceptions or myth about athletic training?
So, again, you know, us being personal trainers, right? So that's not really our role. While we have the knowledge for that, that's not going to be our main role. I would say that we just know like how to tape people's ankles and give people ice bags, right? That's not it. I would say myths or misconceptions is, or I guess something to be more aware of. Again, how much time, how much commitment, how much energy is put into the patients' lives, right? We're there before anyone gets to the facility. We're there way after anyone leaves. We're there, you know, putting our lives, hours, family life, you know, home social life on the back burner to care for these people who are there, and then they leave. And then if they think about us twice, you know, great. If they don't, it's, you know, we still show up every day.
Yeah.
So, misconceptions, maybe it's just that we don't do as much as we do. I don't know. There's so much, but
Well, I think you got it.
Yeah.
This is actually a pretty cool question, I think. Can you share the importance of work-life balance with athletes?
Yeah.
And their training?
Yeah. So I worked with UCF athletics. So obviously like D1 program, a lot of the people I was working with, full-time student athlete, right? So they wake up, they go to practice, then they go to treatment, then they go to class.
Yep.
Then they go to tutoring, then they go eat. Then they come back to the training room for a second treatment, then they have workouts. Then they go to bed and repeat, right? So there's not a lot of time because they have so much pressure to succeed in school and academics, while eating properly, while performing at their top, while, you know, trying to be well respected and involved in the community. So I don't think there's a lot of time to have, we'll say like work. That's a full-time job to me. If I was a student athlete, that'd be crazy. But there is a lot, and I think having the support of people around you who are in a similar scenario is helpful, and also having someone to talk to is very helpful. We referred a lot of patients to like a sports psychologist who is able to manage sort of that work life, stressors, time management, coping with different things. But
so therapy.
Yeah, exactly.
Yeah.
I think that's very helpful.
I think, therapy is helpful for even non-athletes.
Yeah.
But specifically for athletes, of course.
Yeah. Yeah. I don't know if there is much of a work life. When you're a student athlete, sometimes it seems
work.
that way. It's just work, go. But off season, I think is a time for it. And I think different coaches provide different, you know, guidelines or interactions with their athletes that make them either feel more comfortable to come to them if they have something going on, or if they need time off, or if they are not feeling like they're performing well, versus like hiding it, keeping to themselves. Like I feel like there's more of an open communication amongst student athletes more so now than there was before, because we have more access to different resources.
Yeah, I never did any college sports, but I did in high school. I wrestled, and you would go to school, you get off at I think 2:30 or something like that, and then you were in practice for 3-4 hours, almost till 5 o'clock that night.
Yeah.
And that was Monday through Friday.
Yeah.
We were a competitive wrestling school. I think we took first in state many times.
Oh, that's awesome.
Yeah. So, but that, talk about burnout. I only did it for 1 year.
It's
and
a
then
lot.
I told my dad, I can't do this anymore.
It's a lot.
It was, and there was no, my dad's from the old school generation. Suck it up.
Yeah.
Do what you gotta do.
Yeah.
And I was just like,
yeah, that's definitely a mindset that, suck it up, just get through it and, on to the next. But I think collegiate's like one sort of thing in its own realm, but also you deal with high school athletes too. And they're playing every sport, every season, right? They don't have an off season. Or our dancers, for example. I've had so many patients who are dancers and I'm like, oh, what'd you do today? They're like, oh, I'd practice, or, I'd rehearsal. I'm like, oh, what are you going to do this weekend? Rehearsal. Oh, what'd you do? I went to camp, like a dance camp. And I'm like, do you have time off?
Yeah.
Like, what's the deal?
Do you sleep?
Yeah. Because they're going to school and like as a kid, you want to have friends, you want to go socialize, you want to do this, you want to do that. I didn't have really like a social life until after I graduated undergrad.
Yeah.
Because I was just so busy with school and then not extracurriculars, but like school and then athletic training and then whatever.
Yeah.
So like my normal college experience, work life was non-existent. And I'm okay with that. Now I'm in my late 20s living my college life, right?
Yeah.
I'm okay with it. But yeah, for high schoolers, like sports specialization or I think let the kid do what they want to do when they want to do it. Structure is good, but having a normal life is also very healthy.
Yeah. I mean, the best athletes obviously are going to be the talented ones, but also the ones that have that desire and motivation to do it.
Yeah, the grit is so important.
Yeah, once a kid doesn't have the desire anymore, it doesn't matter how good they are, how not good they are. If they're burnt out, they're not going to perform at their best.
No.
So...
Yeah. And, we do wind up seeing a lot of patients who are coming in with an injury because it's just been too much load on their bodies. And unfortunately, again, listen to your body. Is your body telling you that you're tapped out? Yeah.
Yep. Okay. Let's go to yoga.
Let's go to yoga.
Yes. So what inspired you to become a yoga instructor?
Yeah. So in college at UCF, in undergrad, we had an opportunity to take a course in yoga. So it was like a 3-hour class every week. And this would be one of my extracurriculars or like one of my credits that didn't really matter, but I needed to get it done. So I was like, oh man, let me do yoga. I'm really flexible. This will be super easy for me to do. So I signed up for it with one of my friends and it was great. It was 3 hours in this freezing room at UCF every week. And I was so excited to do it. Learned some arm balances, was super bendy. So it was easy. And then that was it. I'm like, okay, cool. This is great. So I liked yoga and I always danced when I was younger. So
just real quick, that was accredited course?
Accredited course at UCF.
Wow.
Yeah.
Okay,
so that was in undergrad.
Okay.
And then, and in undergrad, I didn't really go to the gym too much. I was just kind of like being active, doing intramurals, whatever. But I wasn't like super a gym rat.
Yeah.
And I was about to say gym bro. I wasn't super a gym rat. I wasn't super into yoga. I was just active doing stuff. So, and in athletic training, just like working my booty off. So, after I graduated UCF, was working as an athletic trainer, stopped working at UCF, and then started working at the company that I'm with now, I met a patient who then became my yoga teacher. So through my job, I met her, and she had studied in India, and she is just fantastic, an amazing practitioner. So I wound up going to the studio, experiencing Ashtanga yoga, which is a traditional style of yoga, and it's very like regimented and routined, set sequences, stuff like that. And you do the same thing every single time. So I would show up and I'd be doing the same thing every single time. But in my type A sort of brain, that was nice because I could see when I was improving and I could see when my body was off because I wasn't feeling the same as I did the day before. So I would get in that routine. Then I was like, she's like, you want to do the teacher training? Yeah, sure. So I went through the teacher training, 200 hours. Every 2 weekends, we would get together with a group of other students and we would study, all the asanas, all the postures. We would study the traditions, the spiritual aspect of yoga, all the different limbs of yoga. And then boom, after the summer, I was a teacher and then I got into PT school. So it kind of all... Let's see, that was in 2017. So I've been practicing since 2017 more consistently, and then a teacher since 2018.
Got it.
But my practice of yoga has definitely evolutionized.
Yeah.
And also there's times where I'm like super gung-ho about it and then super like, I'm thinking about CrossFit more now, you know, or I'm, you know, I've always been in it now, but I think understanding yoga is not just about being flexible. There's so many other intricacies to it, has made me more aware as just a human being in life, more enlightened, more appreciative, finding the light and the joy in every single thing around me. That's practicing yoga. It's not just sitting there on your mat, you know?
Yeah. I've always liked yoga. I used to do it pretty regularly. I don't now, but as I think about it more, as I talk to you and I talk to Bryce, it's like I want to start getting back into it because I love, and I think it's so important, your mental state and your body are linked so well that you need to fix one in order to fix the other, or like both need to be good, you know? Yeah. So yoga basically does that, you know, it connects your mind to your breathing, to your body, to your movements, to your posture, you know, to your pose, everything. And it just, that mindfulness of your body feels really good. And it's such a huge stress reliever.
Yeah, definitely.
It really is. So I prefer the hot yoga though.
Yeah.
Is that different from Ashtanga? Ashtanga?
Yeah. So there's kind of like so many different types, right? So Ashtanga yoga is not a heated room traditionally.
Okay.
But the premise of it is that you wind up building internal heat. So having an overdrive of heat is not really wanted.
I see.
Yeah. So you start with, you know, breath work, which produces your internal heat, and then your body is heated externally by your movement.
Okay.
Yeah. But hot yoga kind of is a little bit more the lines of like Bikram, right? So they heat the room for Bikram usually. And then again, similar in the terms of Ashtanga with the sequence, set sequence, you do the postures very routinely through the sequence. It's not very flowy or transition-y. It's more like do this pose, then do this pose, then do this pose, then do this pose.
Okay. So is it concentrating more on your mindfulness than
I'd say
flexibility and
I mean, it's all encompassing, but the reason we do asanas or postures in general is to clear the body so the mind can be still. Like that's the whole point, right? In traditional yogic practice, right? You've got your Eastern yoga and your Western yoga.
Yeah.
Western yoga is like, let's sweat.
Yeah, let's sweat.
let's you know, and then Eastern yoga
let's turn this into a workout.
I know, exactly. It's like, okay, we're doing crunches. Like that's great. I'm glad you're doing it. Because any sort of mindfulness practice.
We've totally done crunches in the middle of a hot yoga session.
Yeah, of course. That's yoga, right?
It's like the slow bicycle one. And everyone's just suffering and just like, can we stop?
It's like, all right, let's stand on our toe and hold that in a mini squat, in a pistol squat. But no, I mean, there's different types of yoga, and no one type is perfect for any person. I think someone just going out and doing it, you're showing up for yourself. You're giving yourself space to move, to breathe, to be. Because if I just show up in a room and I'm just stretching, then I'm just stretching. I'm not doing yoga. Yeah. If I'm breathing and being intentional with my movements, with my focus, with my breath, I think that's doing yoga. Yoga is a study of the mind, mind and the body.
Okay. So yoga often includes meditation and mindfulness. How can these techniques be incorporated into everyday life for mental clarity and relaxation?
Yeah. So there's a part in the Bhagavad Gita, which is basically like a yogic text, I'd say. Not very spiritual. It's kind of just a story of, okay, let me kind of summarize. So there's a part in the text where it says that your mind can either be your friend or it can be your enemy, right?
So true.
So yeah. So So you can either address your mind and your body and have it be something positive, or you can look at the negatives and just let it hang you and carry you down. So daily, I think practicing yoga in terms of your daily life would be living by appreciation, knowing that there are things all around you that have joy and that have you in it, right? So your maybe not personality, but like your positive energy in it. So I can look I can look at this painting and be like, wow, that's so bright and vibrant and powerful because of the red. And who is this?
It's Muhammad
Ali. I can't even say the seconds in the way. So yeah, like, wow, I can see so many great qualities in that painting. Or I can, you know, look at that thinker and be like, I'm inquisitive, I'm thoughtful. So I think just being present, brushing your teeth, noticing just how the toothpaste tastes in your mouth, or the texture of the brush on your teeth. That's a mindfulness practice that a lot of people just go through the motions, right? Yeah. When you're eating, people are like eating and driving, or they're eating and watching TV and they're being distracted. A big thing. Sorry, go ahead.
Yeah. Well, so is it like a sense of just
awareness,
gratefulness, and being grateful in the moment?
I would say like awareness of the actions that you're doing and why you're doing them, and what emotions it brings you, right? So like, how does this room make you feel, right? Like what sorts of things in life, or what sorts of actions are you doing? Is it benefiting you, or is it bringing you down? Are you doing harm on others? Or did Bryce talk about the yamas with you at all?
I think we touched on it a little bit, but he wrote a book.
Yeah,
I think on these yamas. I have it too.
Yeah,
I do.
It's great.
Yeah, he wrote a book on it, so I haven't got to read it yet, but.
So it talks about like, because the limbs of yoga have the yamas, niyamas, and then the asanas, and then a bunch other with like focus, meditation, concentration, all that. But the one that he talks about in his book is talking about basically the moral structures we can live by. So it's do no harm on others, truthfulness. So these different aspects of the way we should live, or the guidelines of which we should live by. So that's, you know, being honest to yourself, not having things in excess that you don't need or that are pulling you down, like not being super attached to materialistic things. All these things, like, these are all yogic practices that doesn't require me to be on my mat. You know, these are things I live by daily. Or try to.
Yeah, it's hard sometimes. I read a book recently. It was weird, strangely, half about how to make money, and then the other half how to be happy.
Yeah.
But this guy, Naval Ravikant is his name. He basically got the happiness portion from Buddhism and how they approach happiness.
Yeah.
And a lot of it has to do, and I'm pretty sure you would agree with this. Do you think happiness can only come from inside? So like, external things can't bring you happiness. They might bring you pleasure in the moment, but if you're not a happy person inside, eventually that pleasure will dwindle away, whether it be material things or a person, you know? So I liked that idea of like, you can actually, it may be hard, it may be difficult, but you can actually control your happiness just by like thinking it inside or working on it inside. And honestly, I've done this before and it worked for me greatly. After I read that book, I started to put into practice, like, I'm in control of my happiness.
Yeah.
I immediately, maybe not immediately, it might have taken a couple weeks, but I immediately like let go of everything that was bothering me externally and just focusing on my internal happiness, and it just made me happy. Yeah. It made me so happy, and I was like, oh my God, it actually worked. I couldn't believe it actually worked. And, you know, material things, external forces can make you, that's why I like the difference between happiness and pleasure. Like, they can bring you pleasure, but it's always going to be momentary. Whether it's money, whether it's cars, whether it's another person, you know, you can't rely on external things to make you happy. And I feel like once you become happy inside, then that will be a magnet. People will be attracted to that positivity. Yeah,
energies attract, for sure.
Yeah, so if you're having any kind of like social anxiety or any of this stuff, the more you give into that social anxiety and you start being in your head about it, it's actually going to, that negative energy is going to show in your kind of like your personality aura, whatever you want to call it. Just walk around like a depressed person, and it's going to push people away. As soon as you get happy inside, you're going to see people are going to like gravitate to you. And then you have that external reinforcement of happiness and pleasure from social interactions or whatever.
Exactly. I mean, they say like, oh, I have a friend who's like, "Why you're always so happy? How are you always so happy?" And I'm like, I don't know. Like that's just the way it is, because I don't. Of course, like I cried a few times this week. I'm not always happy. But I think your mind can either be your friend or your enemy. Like it's important that you don't let these things tear your ego down, because who needs our ego, first off, right?
Yeah.
Right? Like it's important. It gets us places and it makes us seem like we're this or that, but you are your own person, whether you compare yourself to someone next to you or not. Your feelings are valid, and it's great to express those things, but to not sit in this pit of, oh, why is the world so heavy on me? You are the world. The world is you. The world is not every other person, and the financial burden. Like you can. In my head, I feel like I can overcome all things. A lot of people, this is why yoga is so important, or just in general being spiritual about something, right? Because people say they have God within themselves. God can be, the Christian God. It can be the universe. It can be Buddha. It can be, nature. Whatever you see, something that fills you with wholeness, I think, is what you need to carry with yourself daily. Like knowing that this life that we're living right now is not, this isn't the end, I don't know. I think there's such a wider concept. Like we are this little speck in terms of the universe, and people are so like, oh my God, that person blocked me on Instagram. Yeah. Come on. Come on. There's bigger things to worry about. Be appreciative of where you are. Find the joys in the little things, right? Yeah, there's just...
And that's something I think is actually really important. I was talking with someone last night about the detrimental effects of social media and how it has crushed people's mental health.
Yeah. Oh, I sit there comparing myself to every single girl I see. I'm like, oh, I want that body. Blah, blah,
exactly.
Blah. But I'm like, man, people are probably doing the same thing.
There's that saying that comparison is the theft of joy. Mm-hmm. And it's just like so true. Yeah. If you just sit here and constantly keep comparing yourself to what you see on social media.
Yeah, no.
And for the most part, you're seeing the best of someone's life, or at least they want you to think their life is that good.
Yeah,
and
of course.
We all have our issues most of the time.
All the time.
Yeah. Most of the time, those people have just as bad, self-esteem issues as you do, probably. Mm-hmm. I don't think, no matter who you are, whether you're rich, whether you're physically attractive, everyone has their own issues in their own way. Every single person.
Yeah.
So, don't try to compare yourself. Do what you got to do for yourself to be happy. And, you'll live a happy life.
Yeah.
Yeah. You'll just live a happy life.
I think when to emulate happiness, it comes towards you.
It does. I truly believe, other than medical depression and certain edge cases. Of course,
very important.
Yeah. I truly believe most people can make themselves happy by working on trying to get happier. Mm-hmm. I think you can do it. Yeah. I've done it. Yeah.
But that's the thing, I found that through doing yoga and learning about these practices of daily integration of spiritual awareness and just awareness in general. But people don't always find that. They might need someone to bring that through them path, which is therapy, which is a friend who's been through a hard time that can relate to you. It can be, what people are always looking to find what makes me happy, what makes me rich, what makes me feel better than who I am now. Mm-hmm. I think the happiness comes with not trying to constantly be better, but being content with your present. Yep. Great. Yeah. Continue to grow.
Yeah, of course.
I think that's a lifelong goal that is everyone should have, continue to grow. Yeah. But also being content with the present state.
Yeah. You should continue to grow. And, if you want to make more money, or if you want to improve your life, and those things are good. Just know that don't think that once you get that thing that you're going after, that
like,
you're going to be
that's
happy
happiness.
at that point.
Yeah.
Because you'll get to that point and then you'll find out that it didn't make you happy. And then you'll do the next thing. Well, maybe if I get, instead of $1 million in the bank, what if I get 5 million? Then I'll be happy. You'll get to that 5 million. You won't be happy. So, yoga, I like that yoga kind of doesn't need any of those external factors. It's always focusing on yourself. So if anybody wants to work on this, as long as you're working towards something, everyone's different. Everyone's going to achieve this thing different ways, whether it's yoga, Buddhism, religion, whatever it takes. But once you understand the concept of your happiness literally comes from inside yourself.
Yeah.
It'll click one time and then you will just become a happy person.
Yeah. Yeah.
So it's not to say that you're going to have down days. Everyone's going to have down days.
Yeah.
But just remember.
We're human.
Yeah.
We're human.
Just remember that you can bring yourself back up. You totally can.
Yeah.
Okay. That was a little off topic. We're going to kind of switch back to yoga here.
All as well.
One more thing before we end this, because we're nearing the end time. I wanted to go over these yoga, the yama, the nayama, asa.
Yama, niyama, asana.
Yeah, just because I want a brief explanation on this, because you have these things here, and I guess they're talk about breath control, withdrawal of senses, concentration, meditation. So are these concepts within yoga?
Yeah. So I said earlier that yoga is not just a practice. That's only one limb. So in Ashtanga yoga, Ashtayu means 8 in Sanskrit. Sanskrit's the ancient language of yoga practice, or Hinduism, right? So it's Latin, right? Most of it. So for Ashtanga, there's 8 limbs. So the first being yama, and then the yama is basically these moral disciplines that we live by, and this is what Bryce's book is on. If you don't have it, you should get it now.
So it's all specifically on yama.
Yeah. So within yama, there's subdivisions, and the yamas have different classifications of just things we should live by day in, day out.
Okay.
The niyamas, so these are all the 8 limbs, right? Yamas, niyamas, asana, pranayama, pratyahara, dharana, dhyana, and samadhi. So these 8 limbs have little subdivisions in each of them, but those are the generalizations. So within our daily life, we can do the top 3, yama, niyama, and asana.
Okay.
And then pranayama is breath control. So these are the breathing techniques, alternate nostril breathing. It's withholding of breath. It's training the body and the mind to kind of reach a higher state.
Yeah. Yeah. Okay. So we were talking about the 8 yamas, or
8 limbs of yoga.
8 limbs of yoga.
Yeah. So yama, the moral disciplines. Niyama is the daily observances and duties, positive things you're supposed to do in life.
Okay.
Then we've got the asana, which is a physical practice, or the postures.
Got it.
Pranayama, which is breath control, breath techniques. So again, this is alternate nostril breathing. It's breath of fire. It's different meditative techniques with the use of breath that is supposed to elevate the mind to a higher level.
Okay.
So with the breath control, then you've got pratyahara. Pratyahara is a withdrawal of senses.
Okay.
So not to become numb to things, but to become aware of the present state and not to rely on any one specific sense. So to be able to withdrawal from the maybe indulgence in senses, I would say. And the goal of all the 8 limbs of yoga is to reach samadhi, is to completely let go of your ego and to reach enlightenment. Samadhi is enlightenment. Okay. So if you're thinking of the chakras and stuff like that, your crown chakra is that highest level of enlightenment. And that's really the goal of yoga, is to reach that. Now, we kind of say that nobody reaches samadhi, right? You need to go into the jungle in the middle of the Himalayas and just sit on the highest rock and just completely be by yourself to be able to reach this, right? Life happens and you have different things that go on.
I don't know if we have that here, but getting away and going to nature and just probably meditating next to a lake sounds pretty amazing.
Yeah, the Brahmins and stuff, that's, that's what they're trying to do, their life goal. But, so the concentration and meditation aspect, the dharana and dhyana that come into it, these are all the higher level focus, higher level meditation, withdrawal, and truly introspectively looking at yourself while also releasing yourself, right?
Okay.
To be present, yet not attached to anything.
Okay. We're getting into some high level things, concepts that are hard to wrap your mind around.
Yes,
But,
very much so.
Yeah.
That's why they say that, sometimes the human mind is not able to reach that level of consciousness.
Yeah.
Right.
Is it like kind of like outer body experience?
Yeah.
Is that what you're trying to achieve? Okay. Yeah, that seems difficult to do, but not unachievable.
I think there are human beings who are very highly aware.
Yeah.
And I think self-consciousness is something that I find that the more like-minded people are more aware of this level of consciousness, but most people can't even conceptualize that level of consciousness. Yeah. I think honestly, and not to be whatever, but I think if you've taken part in some sort of brain-altering chemicals that maybe you may be able to understand. That's the most appropriate way to put that, right?
Yeah, it is. Yeah, we can say it.
Yeah. So like if you've ever like
a mushroom trip,
then you may be able to conceptualize some of these concepts.
Yep.
But from a grounded level, it's sometimes tough to be like, I don't even know what you're talking about right now. Right?
Yeah, I think you're absolutely right. Most people I know should probably trip on have like a psychedelic experience once in their life, because it does bring a level of clarity to the way things are in the world and in your life in always such a positive way. I've never known anyone to have had a psychedelic experience and not come out of it feeling a little more enlightened about life. Like they always come out of it positive. It does something to your brain, obviously, that, I don't know, it does pull you out. There was, last time I had a psychedelic experience, I remember just closing my eyes and it just felt like I was like floating through space. And I had all of these positive thoughts, and I had one thought that might be kind of scary, but it didn't feel scary at all. And it was, I said, if I die right now, I would be totally fine. My fear of death was gone. Yeah. It was completely gone.
I think it's something that psychedelics in general, I mean, you've got different types obviously, but I think in terms of mushrooms, at least, any sort of brain altering chemical can definitely, it depends your mindset and your intention, I think, going into it. If you are very intent on finding a little bit more of a spiritual journey, or having questions answered, or trying to like just be a little bit more aware of life or nature or whatever, then you're going to wind up having a good experience. But also, there's detriments to it too that can happen. But no, I definitely, it does alter your brain. I have a friend who does. I have a podcast episode with him. I just haven't released it because I hate editing. Yeah. Maybe you can help me. But he talks about like the neurotransmitter changes and just like everything that happens in the brain, and how complex these ideas can be, but how clearly it's able to come into reality kind of when you're going through it at the time. But yeah, it's
awesome.
Yeah.
I will wait for that episode. Please,
I know, I
please
need to release
edit it.
I need to release it. It's been like 3 months.
Yeah, that sounds so interesting.
Yeah,
Holy
it's cool.
Smokes. Okay, is he like a neuroscientist or?
So he studied a lot of that in undergrad, and I mean that was like his main field of study for like all of undergrad. So yeah, awesome. He knows a lot about it.
Awesome. Yeah. Okay. Yeah, get it out.
Okay.
I'll be the first one to listen to that.
I need to. Maybe this will give me motivation to do that.
Yeah. So, okay, I think we only got one more. This is the last one, and then we're done. The Samadhi?
Yeah, so Samadhi is the enlightenment portion of it.
Okay, so that's where you're trying to get to.
Yeah, pretty much. So, right, like, it's, things that we can do daily life, daily, like, kind of, when you think of yoga, when you think of 8 limbs of yoga, or you think of spirituality, or you think of CrossFit, or you think of like anything that you do in life, you want to live life a certain way, right? Yeah. Like even Christianity, if we talk about religion, you want to live life a certain way, and then you have to have the journey there. So it's your daily practices, your awareness, the morals that you instill, the the guidelines that you live by or the truths that you hold, and then the ways to put that into action. So the way to put it to others, and then how others put to us. But then the work in yoga that I think is different is what are we doing for ourselves without any outside distractions that is leveling us up to get to the higher enlightenment, right? The higher level of consciousness. So it's like what we give to the universe, what the universe gives back to us, but then what are we putting into ourselves? We're clearing our body of any blockages via, muscle tightness or joint stiffness or strength deficits. Like that's a yogic practice, right? It's like moving the body, getting all these things moving, getting your digestive system going, clearing your chakras, being able to have a fluid stream of energy or prana, the energy to flow freely for enlightenment, and to let our mind settle, because people can't do that.
Yeah, that's hard for even me to do.
Yeah.
I mean, this is probably what anxiety is your mind just can't stop moving.
Exactly.
And it's just...
Yeah, it's tough.
Yeah.
A lot of people are like, oh, I hate doing yoga. I'm like, why? What's wrong with yoga?
Those are probably the people that need it the most.
I can't sit still. And I'm like, I think you need it.
Yeah. I mean, yoga does a good job because it kind of puts your body in a physical strain, but then also asks you to like be mindful and at the same time. So like for people who have ADHD or something and have that mind turning thing, if you're sitting there trying to focus on holding this pose, at least you're focused. And your mind you're not thinking about the dumb thing you said at work today, or, did I leave the lights on at home? All of those things go away and now you're just focusing on one thing. Yeah.
Although I do feel like when you do show up on your mat, it's the perfect opportunity to let all that stuff happen. Yeah. Like I teach at Crunch Fitness. And so while we're teaching, while I'm preaching to the choir, I've got people outside and I'm like looking at them outside in the gym. I'm like hearing all the clanking. I'm not focused. Yeah. But I think it's an opportunity to just kind of let your body be aware of things that are flowing, going in and out of your brain. And then just kind of being, it's just just the awareness of it all, really.
Yeah. Awareness.
Yeah. Biggest takeaway, awareness.
Yep. All right, Gabby. Thanks for coming on.
Yeah. Thank you so much for having me. This is fun.